Sanibonani kama Nosipho, welcome back to my channel. Today's video is another Ask Dr. Nosi series video, and today's video actually has an inspiration behind it. So I was on Twitter the other day and I came across a tweet by Beulah Baduza. I will put it on my screen so you guys can read it if I can find it. And in this tweet she basically reiterated that she was getting into a new relationship or trying a new thing, and when she brought up STD testing to this person, they either ghosted her or just stopped talking to her, something along those lines, or refused, I can't remember. But I found that really fascinating because that's a really important conversation to be having. So kudos to Beulah for having that conversation, and also something really important for you to do if you're going to be getting into a new relationship, especially before getting into sexual contact with that new person. So I then decided to go on Instagram, right? Do a poll to be like, hey, let me gauge how people are feeling about this whole STD chat. And when I did the poll, I usually get like maybe 80 responses to my polls. A good amount of you guys respond to these polls and you're interested and you engage. I probably got about 20 responses, which is very little for me, and I was quite shocked because you guys usually engage, and this made me realize that y'all are really uncomfortable with talking about STDs, and that's why I'm sitting down here today giving you guys a pep talk, doing the 411, because if you're going to be having sex, it's great, it's enjoyable, people love it, but it's also risky. So you really need to be aware of what you can get from having sex, the risks that are around it, and how you can protect yourself from getting it. So we're having an STDs pep talk on this Ask Dr. Nosi series episode. I hope you guys enjoy it. I hope you guys engage in the comments down below, ask any questions if you really have any, and I hope these are conversations you will definitely start having in your relationships before you get into relationships, so you protect yourself and you don't put yourself in a position that you maybe in the future can't get out of, that really honestly could have been prevented. So until the next clip, I love you all so much, and God ever stay blessing you. As always, we'll start by defining what is an STD or an STI. It is a sexually transmitted disease or infection, and we have shifted more to calling them infections because that was more all-encompassing of the syndrome of, I guess, clinical presentations than disease was. So we'll call them throughout the video sexually transmitted infections. And as the name suggests, these are transmitted sexually, so sexual contact. So it's not only genital to genital contact, it can be transmitted from oral contact, genital contact, anal contact. These can also be transmitted from mother to child, so that would be vertical contact, and also through breastfeeding. Sometimes you can have a strain of infection being transmitted. So there are different ways that these different infections can be transmitted, but the primary ones that we're going to be focusing on in this video would be oral, genital, and anal transmission of these infections. Maybe a good way to split these up so we have like good compartments in our heads, right, is into three. So we have ulcerating syndromes, which basically means when you have this, you have a sore that's accompanied with the syndrome. So you'll have a painful sore, a painless sore, sometimes it's many sores, sometimes it's one, but basically ulcerating syndromes. The next group will be discharge causing syndromes, so meaning that you have a discharge that accompanies the syndrome, so obviously something is coming out of the nether regions. And then the last one, I don't really even know how to properly classify, but I suppose growth causing syndrome, meaning that you have an actual growing lesion in the area when you have this infection, just so that we can have a good idea of where we're putting different things. The first one we'll start with is, I would say, the most common one that we encounter and the one that we test for most commonly, and that is syphilis. And syphilis is caused by something called Treponema pallidum, which is a bacteria, and that invades the genital mucosa, and that can cause an infection there. So syphilis can be divided into primary, secondary, latent, and tertiary syphilis, right? So the primary syphilis is the chancre. So this is like a small little ulcer that you'll get in the area of sexual contact. So that can be oral, that can be genital, and that can be anal, the main places that people engage in sexual contact. You can have this chancre there, and the thing that's important about the chancre is that it is painless, so you don't feel anything when it's there. You'll see it, but you won't feel it. That's why it's so important to pay attention to your nether regions and your mouth, or basically anywhere that you're using when you're having sexual contact, because if you do develop any of these lesions, you'll need to identify them early so you don't miss them, and so you don't have the complications of these different diseases and syndromes. Moving on to secondary syphilis. Secondary syphilis usually presents with a skin rash, and this is a rash that you'll probably have all over your body. It's a dry, scaly, itchy rash, and with that you can also then start having swollen lymph nodes, start feeling really really feverish, because now the syphilis is really dividing in your body, dividing in your lymph nodes, and the infection is pretty much spreading to the rest of your body. So that's why you have those symptoms that are very flu-like. But the thing that will be characteristic about it is that you may also have that syphilitic rash all over your body that's associated with it. I'm thinking twice about putting the pictures up, because I feel like they might deter a lot of people from watching the video, because not everybody is not squeamish, so it's probably a bad idea. But just imagine that there's a really scaly, dry, red rash that's associated with this, that is very common on the limbs especially, that you can find, and also on the torso as well. Then we move on to the latent phase, and latent basically means dormant, and latent phase syphilis, as the name suggests, has no symptoms. So you really would have passed the primary syphilis, secondary syphilis, and now you're at the dormant tertiary syphilis, where the symptoms are gone, but you still have syphilis, you're still active, you're still very capable of passing syphilis on to other people. So that's why these things are really important to test for, important for you to know if people have them, because you won't always be able to pick up that your partner or the person that you're engaging with sexually has a sexually transmitted infection, and in this case syphilis. So latent syphilis, no symptoms, but you're still actively infected. Tertiary syphilis is where it gets really scary, and this is very problematic, and these are the main complications that you can have with syphilis. It can infect all of the organs of your body, obviously resulting in organ failure as an extreme complication of syphilis. It can also infect your eyes, so you can get blindness from syphilis. And finally, syphilis can also infect the brain, which is quite problematic, as you can imagine, and this can even result in psychosis. Syphilis can also be transmitted by vertical transmission from mother to child, and it can have very dire consequences for children when it's transmitted. Lots of complications that are associated with congenital syphilis. So when you're pregnant, it's even more important that you know the sexual status of yourself, your sexual status, and the sexual status of your partner, so you'd make sure that you're not putting your child at risk. And syphilis is easily managed with antibiotics. So if you get tested regularly and we catch it early, then we can manage it before it goes all the way through to tertiary syphilis. So very, very important when you do your STI screening to include syphilis in your screening panel. Do it as often as you can, especially when you change sexual partners, so you don't get infected with syphilis. And you can't catch the people out in terms of them being symptomatic at some stages of the disease. So don't rely on looking at people and thinking they look fine to decide that they don't have syphilis. Test regularly and pay attention if you have any of these symptoms. Another one is chancroid, and that's a very painful ulcer. You'll feel this one, you won't mistake it, you won't wonder two ways about it, you won't be like, maybe I had something. You'll know you have it. It's painful, and this is caused by Haemophilus ducreyi, which is another organism or bacteria that causes ulcers. And this one also results in big swollen lymph nodes in your groin, and that with the progression of the disease, the worse and worse it gets, so the longer it goes untreated, these can get really big and also ulcerate, which is a complication of chancroid. But it's also easy to pick up, because once you feel there's something uncomfortable down there, probably go check, and then you can get tested for that. Sometimes you really don't need to, because we use syndromic management, meaning we use the same set of antibiotics for all of these infections typically, which usually covers them and treats these infections. So watch out for chancroid, but trust that you won't miss it. Also grouped with the painful ulcers is herpes. So I'm pretty sure a lot of us are familiar with herpes, the same thing that causes the ulcers or the cold sores that we have on our mouths. And that's two different strains that we have of herpes. We have HSV1, that's the one that most commonly causes the ulcers around the mouth. And then we also have HSV2, which is the one that causes the ulcers around the genitals. And I really don't like that there's a stigma around genital herpes more than oral herpes, because they're both herpes and they're typically both sexually transmitted infections. Just the one is oral and the one is genital. But I suppose because the genital one is around your genitals, people like to stigmatize it a lot. But the other important thing about herpes is that herpes, once you have it for life. That's the unfortunate thing. It stays latent. It's a virus. So it stays latent in your lymph nodes and pretty much just sheds virus at different intermittent phases. And this will call an what is this thing called? A flare, when you have a flare-up of the virus at some different points in your life, sometimes more than once a year if it's quite severe, sometimes more than 6 times a year if it's even more severe. But herpes, once you've got it, you have it for life. But there are different ways that you can definitely make sure that you don't transmit it to anyone else, because when you're not actively infected or when you're not having a flare-up, you're less likely to shed and transmit the virus to somebody else. But it's really important to know that you have it. So if you want to take different options like suppressive therapy, where you take antivirals pretty much for the rest of your life to make sure that you don't pass it on to anyone else, you can take those options. So this is another thing that's really important to test for. Important to know if you have, because like I'm saying, it's lifelong, and pretty much once you have it, you have it. Also important, once you have HSV1 in your mouth, or let's say you have an active cold sore, you can actually cause genital herpes with HSV1 as well. So sometimes if you're giving oral sex to someone, or somebody gives you oral sex, then you can infect them with HSV1 in the genital area, and they can get genital herpes from that, and even there they'll have that for life. However, the flare-ups with HSV1 are not as common as it is with HSV2. So herpes is another important cause of genital ulceration, maybe more so important because it's something that you have for life. So make sure that you know if your partner has it, so they don't transmit it to you, and make sure that you know that you have it so you don't transmit it to anyone. Because if you look at celebrity law, a lot of people, including Usher, have gotten sued for giving people herpes when they knew they had it, but they just didn't disclose. So really important to know if you have, so you protect those around you, and important to know if you don't have it, so you can protect yourself. That about covers the ulcerative lesions, so we'll move on to the ones that cause discharge. So I'm pretty sure you guys are familiar with all these different things. very familiar. They have very common nicknames, like gonorrhea is called itrop in South Africa. There's chlamydia that's called the clap. So really common. So we'll start with chlamydia. Chlamydia is another very common one. All these STIs are really common, guys, which is another thing that's really important about it, and to not stigmatize them, because they're common, they happen commonly. It can happen to you, you may not be expecting it. So it's really important not to stigmatize them, to talk about them, and to understand that a lot of them are really treatable and very manageable. So we act accordingly and we get the treatment when we need it. Chlamydia, very common symptoms, very similar between men and women. You have urinary symptoms commonly, which means that you have pain during urination, burning during urination, and low abdominal pain sometimes. Also will happen to the male counterparts, which with men, especially if you have those dysuria symptoms, it's really important, because UTIs are not common in men at all. So if you're having symptoms like that, worry, because it's not something that you typically should be having as a man. UTIs are a lot more common in women, which is another reason why it's important, because you may mistake this strain of infections as a UTI when it's actually an STI. So those are common symptoms that you may have associated with your urination. You also then have, as the name suggests, a discharge, and this will typically be a foul smelling discharge. Its consistency will vary, but it will usually be quite a significant discharge that you can see, varying from whitish to a yellowish brownish color, and this will be a constant discharge, so it won't stop, won't be associated with different times in your cycle. It will always be there. And then you also have some sexual symptoms, so they'll typically be irritation, pain, discomfort during pain. Other symptoms can be rectal pain because of proximity. The vagina and the rectum, and the penis and the rectum are really close to each other, so you can have those symptoms as well. You can have some significant bleeding as well, pretty much because the tissue down there is really friable, so because of the infection, so you can have some bleeding that's associated with this as well. And sometimes the cervix can also get really inflamed and infected, and then this can also result in some significant bleeding or a little bit of spotting. So that's also a common symptom that we can see with chlamydia. With men, you can have painful testes. One testicle can be really painful, both of them very painful, one swollen, or both of them very painful, or both of them very swollen, sorry. So that's another thing that's important to watch out for, because these could be signs of chlamydia infection. And then, as I mentioned before, with the other ones, you can also have the swollen lymph nodes around, because lymph nodes are basically your body's way of telling you that there's an infection in the area. So if there's an infection around your genitals, you may have swollen genital lymph nodes. If there's an infection in your throat, you'll have swollen lymph nodes around your throat. So this is also very commonly associated with all of these different syndromes. And when chlamydia gets really advanced or goes untreated for long, the complication complication can be pelvic inflammatory disease, where you have some really severe spread of the chlamydia into your lower reproductive tract, which is basically the fallopian tubes, excluding the uterus. And this can be a very serious infection that can even result in death. And with infection of your fallopian tubes, you can also then have infertility as a consequence, because your fallopian tubes get really, really damaged, and that's where the sperm travels up to get to the uterus. So it's really, really important to catch this as well, because you don't want to have infertility in the future, especially if you're trying to have a child. So this is why it's also important to get treated early as soon as you have symptoms. In terms of treatment, again, very easy fix, the same syndromic management that we give for the others, but chlamydia, unlike herpes, at least once you treat it, it can be treated and it can go away. However, it's really important again to also test for this with your common, or rather your regular STI screening. Very similar to chlamydia, we have gonorrhea, and the symptoms legit are exactly the same, so I won't discuss them again because it's literally the exact same symptoms. It's just that when we test for it, we'll find a different bacteria that's causing the infection, but the presentation, the symptoms, exactly the same, and their manageability, or how they're treated, is also exactly the same. In the range of the discharge causing syndromes, chlamydia, gonorrhea, the same. But gonorrhea also can complicate with pelvic inflammatory disease in females, and it's also very commonly associated with septic arthritis. So if you're finding that you had sexually transmitted infection symptoms, and then now you're also having joint pain, very painful swollen knee, red hot, you might have a septic gonococcal arthritis. So that's another complication of arthritis that's not synonymous with chlamydia. So also really important to pay attention to those symptoms if you have them. The management of gonorrhea is the same as the management of chlamydia, the exact same cocktail of 3 antibiotics that we'll give you, and within 10 to 14 days, sometimes a minimum 7, your infection should clear. But again, very important with all of them, all of these sexually transmitted infections, please don't be having sex with your partners when you're infected with any of these STIs, because that's counterproductive. You're going to reinfect them. If they're the one that gave it to you, they're going to reinfect you. So please try to limit sexual contact while you have an active infection, so you allow time for the infection to fully clear, for your body to get over the infection, so when you're having sex again with this person, they're not at risk, and you're also not putting yourself at risk for reinfection. The next one we'll be talking about is trichomoniasis, also known as the trich. Very, very common, in the same category and family as gonorrhea and chlamydia. So the symptoms are going to be, as you would imagine, exactly the same, except for that yellow-green discharge. You won't mistake it. You will know what it is when you see it. So that's also something that you need to watch out for. It can also complicate with PID. Most of them can, because they can all ascend up the female reproductive tract. So the complications would be similar as well. So the management of trichomoniasis, again, the exact same as the management of our chlamydia, the drop, gonorrhea. Trichomoniasis is treated the same short course or longer course of antibiotics, and you should be fine. This one isn't one that you have forever. It is something that you can get over, but it's really, really important to know that you have it, so we can manage it and we don't have any complications. Another reason why it's so important for us to discuss and understand STIs is that they make it a lot more easier for you to contract HIV, and that's because your nether regions, or whichever affected area it is a lot more susceptible to infection, because the skin is thinner, it's more friable, meaning it's just a lot more damaged, and HIV infection thrives in places like that because it can pass that skin barrier and infect you a lot more easily. And this is obviously now a lifelong infection with HIV. So it's really important for you to pick these up in time, get them managed, because they're usually very simple to manage, so you don't put yourself at risk for lifelong infections like HIV. Under our growth group, we'll start with what I would think is probably the most common growthy infection that you can have, and that is genital warts. I'm pretty sure a lot of us are very familiar with warts, genital warts, and these are caused by HPV, or human papillomavirus. And the one thing that really puts you at risk of getting HPV is HIV infection. Very, very important. And another thing that's important about HPV is that in females, it can put you at risk of getting cervical cancer. So this is why genital warts, really important to catch early, to manage effectively, so you don't get cancer in the future. Now, these warts can look different. They vary in what they look like, but mostly it's like a cauliflower growth, and there's usually a lot of them. It's very rarely one. And another thing that's important about the warts is that once they've started, they won't stop. They'll just keep growing, and they can also grow inwards in females, and with males it will typically grow around the scrotum, around the penis, and around the anus, because you can also have an anal genital wart infection. So this is typically what it look like. Sometimes it's about flattish growth, but usually it's the cauliflower growths that have stalks on them that people will typically experience, or people will typically have. These warts, as you can imagine, can be tender, very, very itchy, and if they're itchy in all these conditions, because they're itchy, you scratch, and if you're scratching, this obviously means that you can cause bleeding. And the other problem with that is when you scratch and cause bleeding, you can then also result, or rather it can also result in you having a super infection. That means you're getting an infection on top of an already existing infection. So that's why it's really, really important to also try and manage these early, so you don't have these complications. Another important thing, which is quite sucky again about HPV, is that people can have HPV but be asymptomatic, so they don't have symptoms, and they pretty much can still spread the HPV to you even if they don't have any symptoms. So again, another one that's really, really important for you to test for, so you don't end up getting it from a partner who's asymptomatic. Next, under the growths, we have molluscum, and molluscum is caused by poxvirus. And if you have molluscum, you're going to have a round bump that has a dot in the center. Pretty much looks like little small donuts. A lot of small donuts. And molluscum isn't purely an STI, which is important, but it is commonly transmitted through sexual contact though, so that's why it's classified under the STIs as well. And usually among teenagers, it seems like they seem to get it the most. So it's a very teenagey virus, molluscum. And molluscum, as I said, which is not exclusively an STI, can be transmitted through people sharing towels, people sharing saunas, people sharing baths. So that makes it very, very tricky to judge where you got it from. But because it's not purely an STI, it can also occur on basically your whole body. So you can have molluscum on your face, molluscum on your chest, molluscum on your arms, molluscum obviously around your genitals, around your mouth. You can really just have it everywhere, but it still falls under the growthy parts of the STIs. The management of molluscum and genital warts is very, very similar, which is why I left it to put it together. And we use topical methods to manage it. So we use creams. Very common ones that we use are podophyllin and imiquimod. And we put those onto the affected areas, and this basically burns these different growths that we have, and this makes them dry up and fall off. Common ways that we use. Then we can also use more mechanical methods, I guess I would say, where we use ice or very, very cold temperatures, cryotherapy, to burn off the warts, or rather freeze them to burn them off. And then we can also use heat therapy like laser, where they literally burn off the warts at the root. The problem with managing these conditions, especially because that typically is what our management is limited to, there aren't any real drugs you can drink to eradicate the infection. The problem is once the infection is too extensive, trying to burn off warts that have grown all the way to the inside of the vaginal cavity, as you can imagine, will be really challenging, or the anal cavity will be really, really challenging. So it's really important to catch these early, because when there's a few small little cauliflower trees, very, very easy to get rid of those, as opposed to an entire forest that's really just grown all the way inside you. We can't really cut that out, and that pretty much now results in a permanent genital warts infection that unfortunately didn't need to get to that point. It can be managed very, very easily. So please, if you see them early, catch them early and seek treatment early. With our HPV or human papillomavirus, we have an HPV vaccine. Very, very important for women, especially in the prevention of getting cervical cancer. You can get an HPV vaccine. We typically give them to people that aren't very sexually active, or people that haven't been sexually active. So the cutoff age generally was below the age of 18, but I'd still advise that you get it, because if you haven't gotten a cancerous strain of HPV yet, then you might still be able to prevent it. So please do go out and get your HPV vaccines. These are available at your clinics, your Dis-Chem. You can get them from your doctor. You need 3 shots in total, or 2 if I'm not mistaken, and that can really save your life, because as you can imagine, cancer is a very serious complication, and a lot of women die from cervical cancer. So if you can get your hands on the HPV vaccine, please do try get it, and this will definitely do you some good in the future. The sun has really been having me in this video. It's setting now because obviously I get to work, I get home from work quite late in the day, but I thought this was a really important conversation that we need to have because people are having sex. So if you're going to have sex though, please make sure that you're going to have sex responsibly, because sexual interactions are literally you putting your life in somebody's hands every time you do it. So firstly, be responsible. Know what your sexual status is. Do a STD panel so you at least know what you have and what you don't have. So when you get into a relationship or any sexual encounter, you know what you're bringing to the table and you know what you're bringing so you don't put anybody else at risk. And when you get into relationships or situationships or whatever issueships you guys get into or we get into, please have these discussions. That whole sex on the first date thing, yeah, I suppose it makes you a little bit free-spirited, and yes, you're in charge of your sexuality and you can do what you want, but you don't know what that person comes with and what they bring. So be responsible with your health, because literally, as we've gone through, some of these things can be so far complicated that it can result in you pretty much dying, and with these ones, quite a slow, painful death. So please don't put yourself in that position. You really don't need to. And if you're going to get into those situations, then at least use protection. No squan, no having it raw when you don't know what's going on. And remember, condoms are not 100%. Condoms are not 100%, guys. And condoms break all the time. They slip off. Things happen, and a lot of these STIs don't really have a PrEP or a PEP like HIV does. So please be mindful of that when you do get into those engagements, that you might be putting yourself at risk. So be free-spirited if you want to be, but do so responsibly. So I really hope this opens the channel or the door for you to be like, hey babe, so did you watch Dr. Nosi's video? What do you think about STI testing? You know, so you at least talk about it because it's important. So I really just want us all to be responsible and to be more cognizant of what we do and to be conscious of our health in general, and I guess specifically in this regard, our sexual health. I hope you guys enjoyed the video. I'll see you guys in the next Ask Dr. Nosi series. Comment down below if you have any questions, anything you want to share, or any video suggestions that you may have so I can have a look through them, answer them if I can. But until the next one, I love you all. Bye.